the Jerusalem Press Club with Dr. Tehila Schwartz Altshuler on walking the thin line between safeguarding the public health and infringing on civil liberties. Dr. Tehila Schwartz Altshuler is a senior fellow at the Israel Democracy Institute and head of the Institute's Media Reform Program and Democracy in the Information Age Program. Dr. Schwartz Altshuler holds a doctorate in law from the Hebrew University of Jerusalem, and she completed her postdoc studies at the John F. Kennedy School of Government at Harvard University. She's a board member of the Israel National Press Council, a board member of the Israel Digital Rights Movement, a board member of the Center for Ethics in Jerusalem, and other bodies. She will start with a short introduction, and then we'll open up for Q&A. You are unmuted, so please type your question on the chat, and she will answer them as best as she can. I want to thank Danai Marks of Israel Democracy Institute and my colleagues at the Jerusalem Press Club for facilitating this webinar. And now, Dr. Schwartz Altshuler, please.
So hi, everyone. Good afternoon. I'm very happy to be here under the circumstances. I want to start by saying that even though I'm a big fan of the right to privacy, which is a basic right in Israel implemented in our basic law, I think that in times of pandemic, things should be different. There's no need to cope with the pandemic with the tools that we've been using during the Spanish flu. This is 2020, and we can use any available technology. It's a matter of proportionality. It's a matter of supervision. It's a matter of thinking about the day after the coronavirus and what's going to be left. Because we need to remember that those technologies tend to stay with us if we need to learn any lesson from 9/11 and what happened with the NSA after that. If we want to take, if we want to imagine some kind of a scale, we can see on the right hand the countries like China and Russia, specifically China, who's been using spying tools that it's using, I think, in its routine life. On the other maybe side of the scale, we can see the European countries, specifically, let's say Italy, Spain, Germany, who do not use any kind of contact tracing or personal contact tracing technologies, but rather prefer either asking their citizens to download applications, which means to have consent to the to the invasion of privacy, or using aggregative and statistics and I would say personal location data. In between, if we still with that scale, in between we can see the Asian democracies such as Taiwan and South Korea, where they actually did use some kind of enforced location data collection, but none of them actually has been using neither the police nor the secret services or the army in order to facilitate this. Therefore, we in Israel kind of took, I would say, the most extreme measures for contact tracing among the democracies, which is, I think, well, I find this very problematic. So let me start by saying a few words about what we need with all this location data, and then I'm going to open it up for questions. The main way to fight the pandemic, as everyone knows, is to find the coronavirus patient and then locate or actually locate the people who were in touch with them. Obviously, when you ask someone to tell you about what happened with his meetings or where he was during the past 14 days. Sometimes people don't remember, and sometimes they don't even know, because if they took the train, they don't know whom, like, were the people that they were in contact with. That's why location data, or cell phone location data, GPS location data, Bluetooth location data could be very, very helpful in fighting the coronavirus. So if we need to imagine ourselves, God forbid, as corona patients, we are in the middle of the circle, and then around us are all the people that were in any kind of contact with us during the past 14 days. And then around them, the second circle of all the people that met those people who met with me. This is a big data issue. You want to use location data, as I specified before, and then you want to analyze this data so that you can understand, first of all, who met with me, how far he was from me, and for how long we were kind of close together. That's the first thing. And then you can tell all those people, get into quarantine immediately. So that's the first thing. The second thing you want to do is to actually find specific locations that are more sensitive for spreading the virus. For example, it could be a supermarket, a synagogue, a restaurant, whatever. But using location data, you can actually locate those specific places. The third thing you can actually get from this location data is actually finding or identifying what we call super spreaders of the virus. Because if I was sitting at home for the past 10 days, and then I'm diagnosed with coronavirus, then I haven't met anyone during those days. But if I didn't know I was a carrier, and I went on the bus and on the train and to the supermarket, it means that there is a very wide circle of people that I could have infected. The reason, I mean, no one is going to blame me for that. I didn't know I was sick, but it is going to be very useful for the health system in order to get prepared. Because if I took the train, then they'll know that within like 10 days, another 50 patients are going to come, or are supposed to come as coronavirus patients to the hospital. The fourth use of this location data is actually understanding specific, let's say, neighborhoods, villages, areas within the country where the virus is more spreaded. And then you can actually create some kind of a quarantine, or some kind of a different treatment to different kind of, or to different places. That obviously is going to be very helpful for the economy. It won't force the authorities to ask everyone to stay at home at the same time. Now, obviously, on the other hand, there's the huge issue of using the Secret Service in order to fulfill this this mission. So about a month ago, the Israeli government has decided via emergency regulation to authorize the Shin Bet to conduct this mission. We all know that the Shin Bet has direct access to the infrastructure of the cell phone network in Israel. This has been done under, I would say, a black wall of lack of transparency. It is a secret service. We have no idea or no actual idea about its regulation, about the way it's the supervision, or anything we can say about the process where the Shin Bet actually collects information about the or data about the citizens of Israel and how exactly it is using them. So there was a huge public, not a huge, but there was some kind of a public outcry about that. There was an appeal to the Supreme Court. The Supreme Court has ordered the government to issue a Knesset committee in order to supervise this whole process. The subcommittee for intelligence conducted quite a few discussions about the ability to operate the Shin Bet. And the bottom line was that even though it might be a time of emergency and a necessity at the time, they called the government to look for alternatives and substitutes for this tool. Alternatives and substitutes for using the Shin Bet could be, first of all, an application which would be downloaded on our cell phones, and then the data, the location data that is being gathered is going to be kept on my phone. Once I'm diagnosed with coronavirus, then I need to give access to this information. But the system can do it without letting the authorities to know where I was and where other people were. They just get a notification to their cell phone in order to get into quarantine. This is, I would say, the most common technique in order to use location data in other countries as well. We know that in America, for example, Apple and Facebook and Google are cooperating now to add another layer to the cell phone companies' data, which is Bluetooth data. And that's how it's going to be a little bit more precise, specifically in high-rise buildings. The other, maybe let me just say one thing. The Ministry of Public Health has actually developed an application. It's called the Hamagen application. But unfortunately, less than 1 million citizens in Israel has downloaded this app. The reason for that, first of all, is lack of endorsement. If we just go back 1 month, before the elections, we know how the Prime Minister Netanyahu has endorsed his supporters to download an election application. But here there was no endorsement, no specific endorsement. I think the government has preferred to use the Shin Bet. The other alternative is actually to get direct access to the cell phone company's data, but then use some kind of a civilized or a commercial system. Commercial systems to collect and analyze this kind of data are actually available in Israel. At least 2 companies are trying to sell this to the government. One is called Duality. The other one is, we all know, is NSO. But this is not the Pegasus system usually used by NSO. It's a different system, and NSO is now negotiating with GDPR European countries in order to start using this company. The same systems are being sold around the world. For example, Palantir, which is a company that analyzes data for the NSA, is now cooperating with the British health authorities, and IBM is selling more or less the same system. So to make a long story short, contact tracing is kind of inevitable in times of Corona. It is going to be with us for the future to come until we fight or find any kind of a solution to the crisis. The biggest question is whether we need to allow the Secret Service to create mass surveillance on all the population of Israel, to do it without any kind of transparency and very minimal supervision, or to try to understand that this is not a national security emergency, but rather a civilized emergency, and that's why we need a more transparent system which would connect the cell phone data directly to the Ministry of Public Health. The discussion that was held in the Supreme Court today was trying to get to exactly this point. Chief Justice Chayut told the government that they need to create a better discussion about the substitutes, about the other options and the alternatives to the Shin Bet. The government, on the other hand, said not only does it want or asks to continue using the Shin Bet in order to conduct this contact tracing, they want to enlarge its roles and ask that it would do more, I would say, deep analysis of the data that it's actually collecting. Deeper analysis, and that would be my last sentence, is kind of using, let's say, AI systems in order to create some kind of a public scoring or a social ranking of different people. For example, if I was exposed to a coronavirus patient, they would like to know my age, they'd like to know my health background, maybe they'll ask for my religious beliefs, because as we all know, the ultra-Orthodox community is more vulnerable now. And then, you know, the sky's the limit. It could be my political opinion. It could be the question whether I'm Arab or Jewish or whatever comes to a hand. And this is all going to be done, as I said before, without any kind of transparency. It would influence my rights. First of all, because it's my right to privacy, and then someone would know exactly where I was, whom I called, where I went online, and whom I sent text messages to. That's the first issue. And the second issue, it would influence my other rights, because this social ranking might influence the question whether I'm allowed to go back to work, to go to public places, to go on the train, on the bus, to go to a supermarket, and so on and so forth.
Thank you. Just for the benefit of our viewers on YouTube, whenever you said Shin Bet, it means in Hebrew, the General Security Services of Israel. A question, you labeled the measures taken up till now as extreme, but there was a motion to ask the GSS, the security services, to take even more functions. And this was, and a subcommittee of the government is supposed to look into it. Do you have any idea which extra measures are considered?
That's what I said before. I think we're talking about two different measures. One of them is analysis, just general analysis of all the data that is being collected, so that the government can get some kind of a map about specific places where the pandemic is more apparent, so that they can quarantine those specific places. That's the first thing. And the other thing, which I'm more worried about, could be some kind of a ranking system, a social ranking system, that would give any citizen in Israel some kind of a score. And this score would influence his or her ability to move around, to go to work, to go to public places, and so on and so forth.
Isn't all that happening already with the telephone companies, with the Facebook, with Google, things that we don't even know? I mean, now we focus on this because of the coronavirus, which is there's a government decision about it, etc. But all the other things are happening without us even knowing.
So first of all, I don't think it's true. In terms of our relationship with private companies, they need our consent, and if we don't give them our consent, or they're using the data for other reasons, then we can sue them. And we've seen things like that in the past. I think that the GDPR has kind of tightened our set of rights in terms of our relationship with private companies. I do want to mention, though, or to emphasize that as it is in regular times, the threat to our privacy can come from two sources. It could come from the government, and it could come from private companies. The same thing happens now. The government is using anything in its ability in order to fight the coronavirus, and it means really infringing our privacy rights in a way that I don't think was ever existed in a democratic country. On the other hand, we are talking about a lot of private companies who wants to either give a hand or open themselves to new markets or making some profit. I don't exactly know, sometimes a mix. But we certainly have on the table, for example, a company called MyHeritage that is volunteering to conduct coronavirus tests together with a Chinese company, which is called BGI. And my question to you is why would a Chinese company volunteer to conduct so many coronavirus tests in Israel? For me, the answer is quite apparent. They want to take DNA, and this is something we actually need to give another thought. We've heard about other companies, for example, Google, who is trying to connect with the Ministry of Public Health here, just as it does in other countries, to create projects such as the Nightingale projects, for example. Google is very interested in health data during the past couple of years. And this is now a very good opportunity to actually get access without the regular process and use this data. I'll just give you an example, not an Israeli one. In California, for example, if you want to get a coronavirus test, you need to fill a Google form, and they ask you all kind of questions there. And the system, which is which was created by Google together with the local government, can actually give you an answer whether you're entitled to get this corona test or not. That's the only way you can actually get a corona test in California now. So Google actually holds all this information. So what we see in Israel is the same thing. We see private companies that are getting involved in all different kinds of aspects of fighting the pandemic, but as a side effect, getting some data or new markets and so on and so forth. I think more than anything else, we've come to see what we knew, what we knew already about the right to privacy. The contact tracing and surveillance are being held upon us, both by the government and by private companies. But now I think it gets to an extreme. And what I find very disturbing is the fact that Israel is becoming, I would say, on the not so flattering side of the scale in this sense.
There's a question. If your problem is not with the tracking location data, but with the security services doing it, and a follow-up question, what is your take on the army being involved in civilian roles?
Okay, so first of all, I agree. I think that surveillance is bad as a general issue, but it's even worse when it is being done by the Secret Service, and the reason for that is the supervision and and transparency. We want to make sure that only the very necessary data is being collected. We want to make sure that no one who is not supervised and authorized has access to the data. We want to know that there aren't any, I would say, side uses in the data, for example, to train machine learnings and so on and so forth. We want to make sure that all this data is going to be erased when the coronavirus is over. I cannot guarantee all those things when my partner is a Secret Service. Even though they can commit to do all this, there is no way to actually know if it's going to be done or not. So in this sense, it's much more disturbing. More than that, we know that there are a lot of false positives in those systems. For example, the system identifies doctors and nurses in hospitals as people who need to get into quarantine because they were near coronavirus patients. Sometimes someone just went through your or near your home, and all of a sudden you're asked to get into quarantine. you have no ability to appeal or to ask about anything about the system, because the system is so is not transparent whatsoever. So in this sense, yes, I think it's a problem, and I think in this time of crisis, public trust in the system is very, very important. So as we can see from countries such as South Korea, for example, everything was done in a very transparent way. People were notified that their phone was surveilled. People knew exactly how the system looked. They knew where they could go and ask for their rights if in case of a mistake. All those things just don't exist here. Now, as to the army, I don't want to talk about the bigger question about the army actually conducting a lot of civilized missions here. But what I can say is that we're causing a huge problem for our soldiers. Because think about those soldiers in units such as 8200, they learn to surveil without borders. Without borders, it means people outside of the country. Without borders means you need to fight with enemies. Therefore, you can do almost everything. Now you ask those soldiers to use the same techniques against their mothers, who are not suspects of everything. They're not enemies. They're not terrorists. They're just sick people. And more than that, I think the Shin Bet itself didn't want to take this job upon itself, because it knew that would create some kind of, I would say, an enforced transparency that it didn't want, or it didn't want to expose its techniques. And some of them were exposed during the discussions. So in this sense, I think it's a very, very bad idea that the army and the Secret Service are involved in surveillance after local citizens. I do have to admit, though, and I've said it before, that when the army is using all kind of, or is developing or acquiring all kind of technologies from surveillance to facial recognition technologies, and using it, for example, in the territories, or using it against enemies, the distance between this and using it on your own citizens sometimes is very, very small.
Okay, you mentioned before the negotiations between NSO and some European countries. Can you elaborate on that? Tell us how far these negotiations went.
I can tell you a little bit about the system. I've seen the system of NSO. They've presented it to me. This is not the actual Pegasus system, which is more, I would say, of a spying technology. NSO has a very bad reputation, as we all know, in terms of protecting human rights. On the other hand, their system actually does three things. First of all, it gets data from cell phone companies. NSO itself doesn't collect the data, but rather it gets the data by emergency regulations from the government, from local government. It could be any country. And then it could give you three things. First of all, it can give you those contact tracing results, for example, whom I met during the past 2 weeks. Second, it can give all kind of heat maps to the decision makers to understand where exactly the situation is worse. And third, they can do all kind of social ranking so that you can understand how to prioritize coronavirus tests. I think that in GDPR countries where NSO is presenting their system, they're not going to use all the options that the system has, because GDPR European countries usually want only aggregated data. So they would use the second option that I've mentioned, which means heat maps and all different kind of statistics about the spread of the virus. Israel, on the other hand, as we know, or not exactly Israel, the Minister of Defense, Naftali Bennett, created some kind of a negotiation with NSO so that the Israeli army could use its system, but they wanted to use all the different options of the system, which means that it would be very harmful for Israeli citizens' human rights.
Okay, last question. With all those grave measures, I mean, how come there's so little reaction from the public? Is the Israeli public underestimating the gravity of these measures?
Well, that's a good question. I'm asking myself the same thing. I think I have two main answers for that. First of all, yes, the Israeli public is not aware of its right to privacy, as we see in other countries, both in Europe and in America. I don't know, maybe Israel is not, it's not in our culture. We consider ourselves very open. We've got nothing to hide, you know, all those kind of things. That's the first thing. The second thing is the fact that Israelis have a very high level of trust in national security organizations. And moreover, we put so much taxpayer money in those organizations, and we create such unbelievable technologies that you know, people say to themselves, why shouldn't we use them now? After all, we've starved the health system, but we poured money on the army. So why in a time of crisis shouldn't we use it? And I think that there's not enough understanding of the level of control and power that someone who, you know, can create this massive surveillance and this AI-based analysis of all this big data can have in his hands. And this is what bothers me, at least.
Last one, a personal question. If you were allowed to leave home, would you think twice before taking your iPhone with you?
I would certainly recommend to people, if you don't want someone to know where you are, leave your phone at home, because it doesn't matter even if you turn it off. The same way, if you need to you know, send any kind of confidential messages, use Signal, don't use WhatsApp, and certainly not a text message. If you want to create phone calls, use WhatsApp and not a regular phone. Yes, I mean, I think it's important. And I think even for journalists, it's even more important if you don't want to be traced.
With these wise advices, thank you very much, Dr. Schwartz Altshuler. Thank you all for joining us, and stay tuned to our next webinar very soon. Thank you. Goodbye.